Dr. Sagar Lonial from the Winship Cancer Institute of Emory University, joining us here at ASCO 2014. Thank you, sir.
Thank you.
Busy conference for you.
Very busy, yes. Yeah.
You're working in myeloma. Where would you say you are right now and what you're able to do for patients?
Well, I think, the last decade has really been quite remarkable. We've doubled the survival of patients. I would argue that standard risk myeloma patients, because of drugs like bortezomib, lenalidomide, carfilzomib, pomalidomide, has more than doubled. In fact, standard risk patients can probably live in excess of 10 years. So it's been really quite remarkable.
Let's talk about the data that you're a part of being presented.
Yeah. So I think, to me, probably one of the most exciting abstracts at the meeting is the Panorama 1 trial. And that is a trial where the new drug panobinostat, which is an HDAC inhibitor, was added to bortezomib and dexamethasone. And in a randomized phase 3 trial, was compared with bortezomib dexamethasone alone. And in this trial, we demonstrated a pretty significant improvement in progression-free survival and a higher overall response rate. And so I think this gives us, hopefully, another new tool now that we didn't have before to treat patients with relapsed myeloma.
So what do you do next with this data?
Well, I think hopefully this will lead to an approval, which will then again let us be able to use it. I think one of the big questions in the myeloma community is what patients are best suited for this treatment, and that's something we have to do a little bit of work on. Some of the preliminary data suggested that high-risk patients actually gained a lot of benefit from the addition of panobinostat, but we've certainly had experience with standard risk patients getting benefit as well. So trying to find the biomarker that predicts response is really the next step.
What's been the reaction you've gotten from your colleagues about this?
Well, I think it's very positive. We all like the idea that the progress we've made in myeloma has been as a consequence of collaborative efforts and new drug approvals. This is yet another new drug approval that hopefully will give us more tools to solve the problem.
Very good. Dr. Lonial, thanks for being a part of Solution. Thanks for stopping by and visiting.
Thank you.
Okay.